Hello everyone, my name is Christina Zaki and today I'm going to talk about constraint induced movement therapy, also known as CIMT, and how it helps improve upper extremity function in people who have had a stroke. So imagine this situation. Someone has a stroke and suddenly has difficulty using one of their arms. Over time, they may start relying on their stronger arm and stop using the affected one. This is something we call learned non-use, and it's actually very common in stroke recovery. As occupational therapists, one of our goals is to help patient return to using that affected arm during daily activities. And the CIMT is one intervention we use to help make this happen. So the learning objective, by end of this lesson, you should be able to describe what constraint induced movement therapy is and identify one way it helps improve arm function after a stroke. So you might remember from neuro rehab classes that a stroke can affect coordination, strength, motor control. Because of that, patients often avoid using the affected arm, and CIMT addresses exactly that problem. So, what exactly is CIMT? Constraint induced movement therapy is a rehabilitation approach where the stronger arm is restricted, which encourages the patient to use the weaker or affected arm more often. There are three main parts of CIMT. First, the unaffected arm is restricted using something like a mat, sling, or towel. Second, the patient practices repetitive task-based activities using the affected arm. Third, the therapy focuses on functional activities that relate to daily life. The idea behind this is to promote neuroplasticity, which is the brain's ability to reorganize and relearn movement after injury. Research has shown that CIMT can significantly improve upper extremity function and participation in daily activities following a stroke. Okay, now I'm going to show a quick example of what CIMT might look like during an occupational therapy session. First, I am going to simulate the constraint by placing this oven mat on my unaffected hand. This limits how much I can use this arm. Now I will use my other arm, which represents the affected arm, to complete a functional task. For example, I might reach this cup, pick it up, and place it into a container. This toothpaste, and grasp it and put it into container. So in therapy, we repeat activities like this many times to help improve movement and coordination. These tasks are meaningful because they relate to everyday activities like grooming, organizing items, or preparing meals. As therapists, we can also grade the activity to make it easier or harder. For example, we might move the object further away. It changes the size of the object or increase the number of repetitions. Now, think about this from your perspective as future occupational therapists. What type of daily activities could you use to encourage a patient to use their affected arm? Some examples might include reaching for grooming items, stacking cups, folding towels, moving objects across a table. One important part of CIMT is helping patients apply what they practice in therapy to real life situations. The goal is for them to use their affected arm more during everyday activities at home. This can help increase independence and overall functional performance. So, if you are interested in learning about CIMT and stroke rehabilitation, I recommend reviewing the American Occupational Therapy Association Practice Guidelines for stroke rehabilitation and research articles published in the Archives of Physical Medicine and Rehabilitation Journal, which provide strong evidence supporting this intervention. So, to summarize, constraint induced movement therapy is an evidence based intervention used in occupational therapy to improve upper extremity function after stroke by limiting use of the stronger arm and encouraging repetitive use of the affected arm during meaningful tasks. Patients can improve movement and participation in daily activities. Thank you for watching my lesson.